What are your credentials?
Family nurse practitioner.
And your specialty?
Currently work in family practice as well as in aesthetics.
How long have you been in healthcare?
About 9 years now.
What jobs did you have before nursing?
So I worked in a library during high school and college. I also worked in retail prior to nursing or during nursing school.
Which jobs or skills helped you the most in your nursing career?
I would have to say actually both the library job and the retail job, because we dealt a lot with customers. So a big thing was customer service, which we definitely deal with in nursing.
What or who motivated you to go into nursing?
I would have to say my mom and my aunts. I kind of grew up in a healthcare home. Like my mom and my aunt, they are certified nursing assistants. So I was always around around them and around like at their job. So I was always in that setting.
Did you consider any other role in healthcare?
I did actually. Initially, I wanted to be a pediatrician, so started off there, and then at one point I also considered doing pharmacy.
How do you respond to the question, why didn't you become a doctor?
I get that question a lot, and people automatically think I'm a doctor anyway. But I would have to say in high school I did a program where through the University of Miami, where we were exposed to a lot of different health professions, including pharmacists, and that's actually where I learned about the nurse practitioner role. And once I learned that, I actually got to meet a nurse practitioner and learned about what she did, and that's kind of what piqued my interest in that field instead of being a doctor.
What do you wish you knew or did before nursing school?
I wish I knew how hard it would be.
Where did you go to school?
So I went to the University of Florida, where I got my first bachelor's. That was a bachelor's of science in nursing. A bachelor's of health science. Then I got a second bachelor's through the University of Miami with their accelerated nurse practitioner program, which was 12 months, the longest 12 months of my life. And then I went to Howard for grad school and got my master's of science in nursing with the family nurse practitioner route.
How did you pick your schools?
Well, for undergrad, for like the bachelor's, I'm from Florida, so the goal was to always just stay in Florida because of the in-state tuition being cheaper, but more affordable for me. I also got a full ride at the University of Florida, so that was like a no-brainer for me. As far as the University of Miami, I just got in and it was just easier because I was able to live at home while I went there. And then for Howard, I just wanted to get out of Miami. So, and I love the DC area, so that's what prompted me to move up here for grad school.
Did you shadow anyone before pursuing nursing or your specialty?
No, I actually didn't.
What motivated you to advance your education?
Well, like I previously said, I already, even before I started nursing school, I knew my end goal was to be a nurse practitioner. So, from high school, I already knew that that's where I wanted to be, so there was no brainer there.
Did you receive any financial support or tuition reimbursement?
Like I said, for my undergrad, that was, for the University of Florida, that was a full ride. For my my UM, that was all loans, unfortunately. But when I went to grad school, I did get some scholarships through one of the companies that I currently work for, and then also the hospital that I worked for at the time also did tuition reimbursement, so I got some money back for that as well.
What's your strategy for paying back student loans?
Just taking it 1 month at a time. That's the killer right now. So I'm actually, if anyone has any advice, I would gladly take it. But yeah.
Advice for nursing students in clinical rotation and orientation?
Not to beat yourself up about not learning everything that you think you need to know in nursing school. I actually was recently talking to a coworker of mine who is in nursing school now at Howard, and she was so afraid that like her clinical program didn't allow for them to do certain things. They can only observe the nurse. I don't know if that was a rule for their program or for that hospital. But I just told her not to like beat herself up about that. Just kind of soak up everything that you can in that setting. You're not going to learn everything that you need to learn in nursing school. Try to get everything that you can in nursing school, but a lot of the stuff that you'll learn it will be when you get into the field and working on the floor and when you're in orientation.
What's one thing you think students should know about nursing that's not taught in nursing school?
That everything that you need to know will be learned on the floor, or wherever, or in the field. I don't want to say on the floor because you may not necessarily be a bedside nurse, and that's another thing. People automatically think that nursing school, like the next step is to be a bedside nurse, and I actually had a coworker that I met that she did nursing school and went straight into dermatology as an RN. So you don't necessarily have to be a bedside nurse if that's not your calling, because it's not for everyone.
It's not for anyone. What, if any, changes would you make about nursing education and training?
Training, I would say the thing that I struggled with the most, specifically in grad school, was finding a clinical rotation. A lot of it, there oftentimes aren't a lot of options. Oftentimes, depending on the program that you're in, you have to search for your own clinical site or preceptor. And a lot of these places also charge. If I can change something, it will be the fact that providers are allowed to charge. I just feel like as a preceptor, you should be paying it forward because at some point someone had to train you to get you to where you are. So I don't think it's fair or right that you want to charge struggling students to pay for you to teach them.
When and how did you get your first mentor?
My first mentor was in undergrad. I was actually part of, this was at the University of Florida. I was part of a program for first-time generation college students. And we were kind of assigned a mentor, but actually liked, even though it was kind of not necessarily forced, but even though it was kind of pushed on us, I enjoyed that because that mentor helped me adapt to being in college. Like I said, my parents didn't go to college. I did have an older brother that went, but it was still something new for my family.
Advice for how mentees can add value to the mentor-mentee relationship.
Actually meet up with your mentor, make time to meet up, ask questions, voice your concerns, and just, even if your mentor doesn't have all the answers, they might be able to direct you in the area that where you need to go to get answers to your questions or your issues.
What specialty did you think you were going to get into at the beginning of your journey?
I thought I was going to be, because as I mentioned before, I wanted to be a pediatrician. So I thought I was going to be either a pediatric nurse practitioner or a neonatal nurse practitioner. That's actually the one I really wanted to do when I was considering NP school.
What attracted you the most to your specialty?
Well, after talking to some people, some nurses, and some nurse practitioners, I went more on the broader route as a family nurse practitioner, since that would give me more access to different specialties where if I did a neonatal intensive, like if I did the neonatal program, I would have to only work as a neonatal nurse practitioner. I'd be limited into what I could do, but as a family nurse practitioner, I can go any way as long as they offer me training.
What deterred you from some other specialties?
To be honest, probably just lack of knowledge of what's like out there or what I can do as a nurse practitioner in specific specialties.
How would someone know if they have what it takes to be in your specialty?
I would say you have to like people because I work with people a lot, and you just have to be more like, because I work in the family nurse practitioner side, in that setting I would say you have to be compassionate, because at times you may come across certain situations that may feel, maybe like patients may be going through a hard time, and you just have to like know how to navigate that and help them in any way that you can.
Who should not enter your specialty?
Someone who doesn't like to work with others.
What does continuing education look like for you?
So that would be like attending conferences, which my plan is to start attending conferences. Also through both of my jobs, they offer certain courses where we can have access to new research that's being done, new information that's out there about what our specialty entails.
What does professional development look like for you?
Also taking that would be for me taking advantage of the opportunities that my job offers as well. Like one of my jobs recently offered a leadership course, so that I recently became a part of that, and we do quarterly meetings. So I'll be doing my first one next month. So just kind of participating in the opportunities that the jobs provide.
What does networking look like for you?
Going to events, meeting, not necessarily even meeting people in only healthcare. Recently, last year, there was a tech event, and I didn't even know that what role a nurse will have in like the tech environment. So just kind of going to that event and mixing and mingling and learning how I can benefit from that.
Where did you learn how to negotiate?
I would say from my brother, and also from other nurses that I've worked with.
How, if at all, has your nursing practice affected your relationships?
Because of my schedule, not currently, but I guess in the past, when I was either working as a bedside nurse or when I was in school, it was just sometimes hard to go out with friends or attend certain events because of my work schedule. If I'm working night shift and they're doing something at night and I can't attend.
How many hours do you work per week?
On average, about 36.
Do you work nights, weekends, or holidays?
I no longer work nights, thank goodness. I do work some weekends, not often, maybe 1 week in a month, and typically I don't work major holidays.
On average, how many patients do you see in a day?
On average, about 25.
And what's your typical day look like?
So typically, I would either start at 8:30 or 9 a.m. And then my work day typically finishes at about 7 or 7:30, and then I'm usually in bed by 10 o'clock.
How much time do you spend on charting?
Not too much time. Like with my family practice job, typically I chart while the patient is in the room with me. So the majority of the time is spent on charting. We do a lot of charting and documentation. So I would say 75%.
What's the most common advice you give to your patients?
I always tell patients to ask as many questions as they need, no matter in both of the fields that I work. I tell them that there's no dumb questions. Just always ask, and don't feel compelled to do something that you're not comfortable with.
What's your most memorable patient encounter?
I would have to say, oh gosh, I can't think of one right now.
What's your most challenging patient encounter?
I have had a few of those, especially working as a bedside nurse. I would say there's one patient that would refuse to take his meds, and we would kind of have to, especially he had a lot of mental health issues, and that was just a challenge to get him to take his meds so that he can get back to his baseline, back to his normal.
What's the toughest part of your job?
Currently, the toughest part of my job, I would say, would have to be dealing with upset patients in the family practice setting. Dealing with patients, like sometimes we're like fully booked and then they come in and they want to be a walk-in, but there's no space. And just having to tell them that unfortunately they can't be seen that day. Sometimes they get upset, even if you try to schedule them for another day or schedule them for another location. I would say that that's the toughest part, because you want to help, but you're only one person, you can only do so much. So I would have to say that would be the toughest part for me.
What's the most rewarding part of your job?
Helping those that I can. In the aesthetics world, I actually, since that job is fairly new to me, I think the most rewarding part for me is actually when I see the clients come back after like their Botox treatment and they love their results and they like refer our company to their friends so that they can come and get treatment as well.
What's your best clinical skill?
I would have to say teamwork.
Who are you most grateful for on your care team?
My coworkers, specifically my direct supervisor in the aesthetics field.
Do your friends or family ask you random medical advice?
They do.
Do you give unsolicited medical advice to friends or family?
Sometimes it depends on what the advice. It depends on the condition, but not usually.
Do you ever get nervous or anxious? If so, how do you manage those feelings?
In the beginning of my NP career, I would say I did get nervous. Now I wouldn't say I don't typically get nervous.
What are your hobbies outside of practice?
I love to travel. I also love sometimes going on hikes, as long as that's a new thing that I have discovered that I like to do. As long as it's not like an intensive hike. I like hiking. I like some outdoor activities. I just enjoy going out with friends, hanging out. I love going to restaurants. I'm a foodie, so I love trying new foods.
How do you spend your days off?
Doing those things. Once again, traveling is like a big thing for me. But typically if I'm not doing that, I'll be relaxing at home, listening to music, watching shows, binge watching shows on Netflix or Hulu.
Who do you go to for help?
And what? I guess it depends on what help I'm looking for.
What's one thing you're afraid of?
Making a mistake.
Coffee, tea, or soda?
Coffee.
Scrubs or no scrubs?
Scrubs. They're very comfortable.
Are you an introvert or extrovert?
I like to say that I'm an introvert. Some people tell me that I'm an extrovert, but I believe I'm an introvert.
Do you think there are more introverts or extroverts in your specialty?
In my specialty, I would say more extroverts.
We're hanging out for the day. What's on the agenda?
We're going out to eat somewhere, going out to eat, going for drinks, having good conversation.
How many hours of sleep do you get on average?
I love my sleep, so 8 to 9 hours.
When does your day typically start and end?
Typically, if we're talking about a work day, typically I am up around 7, at work at 9, done with work by 7, and typically I go home, and then I'm in bed by 10, 11 o'clock.
If you weren't in nursing, what would you do?
I always had an interest in dancing. I would be a trained professional dancer.
How much longer do you think you'll practice?
Hopefully not for too long. I don't think I don't know. Hopefully not till 60, whatever the retirement age. Definitely not until that age.
What should someone who's considering nursing do to prepare right now?
Well, to take their education seriously, to get the good grades, because getting into nursing school, it is very competitive. So having a good GPA and also having a pretty diverse resume and being involved will really help with that.
How has your experience in nursing changed the way you see the world?
It has made me very grateful, especially during the pandemic, or now post-pandemic. It has just made me grateful for my health and for my family's health.
What's your perspective about the current state of healthcare?
I feel like there's a lot of challenges, especially when it comes to insurance and people not having insurance, and their specific insurance is not being accepted everywhere.
What's one thing you would change about healthcare?
It would be the access to it.
Is healthcare a right or a privilege?
I believe it's a right.
What changes are taking place in your specialty as it relates to clinical practice and research?
Well, like I said, I work in the aesthetics field doing Botox. A lot of research is being done for non-cosmetic purposes. Well, there are currently non-cosmetic uses for Botox, but just a lot more research is coming out about other areas that it can be used.
What do you want the public to know about nurses?
I don't know.
If you had 1 more hour in the day, what would you do with it?
Maybe sleep some more.
What's your opinion of healthcare professionals using social media?
I think it's a good thing as long as, they're not obviously breaking any HIPAA violations. But I think it's great because it allows people to have access to the content that nurses put out there.
What did you think you were going to be when you were a kid?
Pediatrician.
What advice would you give your younger self?
I would say not to be too hard on myself.
What would you do if you could do it for free?
Travel.
What can we expect from you in the next 12 months?
More travel.
What advice would you give the aspiring family nurse practitioner in aesthetics?
I would tell them to get all the experience that they can get. Definitely, possibly venture out into different things in aesthetics, such as fillers or wherever they can get the training, like to go that route, and to just not limit themselves with just aesthetics, because there might be other things that they can do outside of it.
Thank you.
You're welcome.